Once you know that you need a hip or knee replacement surgery, then what are the factors to consider before going in for a total hip or total knee replacement surgery? So friends, I'm going to do this video both in Hindi and English. मेरी हिंदी स्पीकिंग ऑडियंस के लिए इस वीडियो को हम हिंदी में भी रिलीज करेंगे. Hello, I'm Dr. Pankaj Valecha and I'm a hip and knee replacement surgeon in Delhi. And in last 20 years, I have operated more than 3,700 patients of hip and knee surgeries and have helped them in getting back to their normal lives. This video is very useful for those people who have been advised surgery and they're still kind of waiting. They have few days to go. So this video is invaluable piece of information for them. So friends, let's dive in. I'm going to tell you 4 important things to consider before you go in for a total hip or a total knee replacement surgery. So point number 1, is there any source of infection in your body? Most common sources of infection in human body are urinary tract infection or UTI, dental infection, chest infection, or having a boil or any kind of a wound which is in your body and which is infected. And if it is closer to your operative area, like for a knee surgery, if it is closer to the knee, and for a hip surgery, if it is closer to the hip, then definitely the surgery should be postponed and we should treat the infection first, because this source of infection can travel into your body through the bloodstream and can actually infect your replaced joint. It is very important to know. Point number 2, and it is very relevant for the knee replacement patients, because many patients who have advanced knee arthritis, they are awaiting surgery and they want to postpone it for, let's say, 3 weeks, 4 weeks, and they come asking, doc, I have very bad knee pain, I'm considering surgery, but I want to kind of postpone it for 3 to 4 weeks. So please give me a steroid injection because that will take care of my knee pain. You must know this. If you get a steroid injection, then literature says that you must not do a knee replacement surgery for at least 3 months, because that increases the chances of getting infection, because steroid generally reduces the blood flow in that particular area, and we avoid doing a knee replacement surgery for at least 3 months after giving a steroid injection. Generally, we do not recommend it to patients who are considering surgery in 3 to 4 weeks time. But if you are ready to postpone the surgery by 3 to 4 months, then you can still consider it. But it is not a solution, it is not the treatment, it is only to reduce your pain to some extent, and which may last sometimes for 2 weeks, sometimes for 3 weeks, sometimes for a month, sometimes a little bit more. But it is not the treatment of your knee arthritis. That brings us to the point number 3. If you have undergone a fracture surgery around your hip or around your knee, then we rule out by doing the blood investigations, which can indicate or which can tell us if there is a possible source of infection in the body, and then we stage the surgery into 2 parts. Generally, we remove the implant and take some culture samples from that area and send it for culture and sensitivity to identify if there is any bacteria. If there's no bacteria, then we can do the hip or knee replacement surgery in the second stage. In selected patients where the implant is stable and there is no sign of loosening of the implant or fracture fixation, it can be considered in one go also. But for that, you have to discuss in detail with your surgeon. But generally, when we see a loose implant, then we are highly suspicious of infection, and we generally do not do a hip replacement surgery in one go, and we stage it into 2 parts. So in the first part, we do antibiotic cement spacer. You can check one video on how we make the antibiotic cement spacer on my channel, and then in the second stage, once the blood parameters have come to normal, we'd go and do the final implantation. Point number 4, if you have undergone a hip replacement surgery and the implant has become loose, I see a lot of patients jinka cup loose ho jata hai, and these patients come for revision hip replacement surgery. So we are highly suspicious if the primary hip replacement surgery, which was performed well but has failed in 1 year or 2 year or 3 year or 4 year period, then we always rule out infection in such patients. And if the cup is loose or the stem is loose, we take out the implant, send the tissues for culture, put in an antibiotic loaded cement spacer till blood parameters have come under control, and also before implantation we aspirate the hip and we check if there is any infection growing in that hip joint after antibiotic cement spacer implantation also. So these are 4 very important things which you should know if you are considering a knee or a hip replacement surgery. I hope, friends, you found this video useful, and this will help you or somebody in your family in deciding the right timing for your knee or hip replacement surgery. For more such useful content, you can subscribe to my channel or follow me on Instagram at Dr. Pankaj Valecha Official. I'll see you in the next video now.